Hello everyone, I'm Pharmacist Michael, and today I am going to talk about fibromyalgia. I've been asked by some of my TikTok followers to discuss this subject. So that's what I'm going to do. I'm going to talk a little bit about what it is, what we know about it, and how we treat it. So fibromyalgia is characterized by pain basically all over your body. And it also comes with sleeping disturbances, fatigue, and other problems just with thinking in general. And really the management of this disease process is pretty challenging. It's difficult to treat. And you know, a lot of doctors used to think that fibromyalgia was just baloney and it wasn't real. And it was one of those diagnoses that they would give when they couldn't figure out what was wrong with the person. But we know now that there is something to it. We know that about 2 to 4% of the general population has fibromyalgia, but we don't know what causes it. So we're not sure where it comes from. We do know that there's a high genetic factor. So if your mom or dad has it, your chances of having it are higher. We think it happens because of the way pain is processed in the body of people with fibromyalgia. So who's more at risk of getting this? Well, we know women get it almost twice as often as men do. We know that if you have other painful conditions, you're more likely to get it, like rheumatoid arthritis, for instance. We also know that mental health conditions such as depression and anxiety coexist in those with fibromyalgia in about 25 to 65% of the patients. Other things that often occur with fibromyalgia are things like chronic back pain and irritable bowel syndrome. Now, what are some of the risk factors that we can actually change? One is sleep disturbances, right? Physical inactivity is one. Making sure we're controlling weight. People that are overweight tend to have more of a risk of getting fibromyalgia. In fact, there was a study done that showed that if you had insomnia symptoms, your risk of getting fibromyalgia was double. And if you were overweight, you had an increased risk of 60 to 70% of getting it. So how do we treat fibromyalgia? Well, there's no specific drug that we use for fibromyalgia. What we're going to try to do to treat this disease is treat the symptoms. So, believe it or not, drugs are not first line. First line is cognitive behavioral therapy and exercise. Those are the two things that show the most promise in this disease. Stress management, sleep hygiene, exercise, like I said, all can help tremendously. But remember, all patients are different. So we got to be careful with the exercise because remember, these patients already have pain. So if we push them too hard too fast, we can actually make the condition worse. But we do find that people that lay around a lot and don't move, their fibromyalgia symptoms get worse. So we really do want to start slow and move in a stepwise approach up when it comes to exercise. Some of the best things really that can be done for fibromyalgia are swimming, right? Swimming is great because your body is immersed in water. Other things that can help, and we've talked about this before in other videos, are Tai Chi and yoga, right? That basically gets your brain going and your body. Okay, I'm a pharmacist, as most of you know, so now let's talk about the drugs. First thing I'm going to tell you, and I always say this, is if you can get by without drugs, you're better off, and the reason is because all drugs have side effects. So the drugs that we use to treat fibromyalgia symptoms are no different. So what do we know? Well, let's start with sleep. We know that over-the-counter sleep aids should generally be avoided. So try to follow your sleep hygiene. rules. I've done videos on that before. We also know that over-the-counter pain relievers don't work very well for fibromyalgia. So the drugs that we usually use are prescription drugs, and the first group and the ones that have been used the longest are the tricyclic antidepressants such as amitriptyline. Now the problem with amitriptyline and tricyclics in general is they have a lot of side effects. They have what we call anticholinergic side effects. So if we start at too high of a dose, you can have blurry vision, dry mouth, you can, be dizzy, drowsy, all those types of things. They make you feel kind of crappy. So we started at a very low dose, like 10 milligrams. If those don't work, we can move up into the milnacipran and duloxetine group, which are SNRIs. These drugs are also antidepressants, but they're good at fighting pain as well. Then we have the GABAergic drugs. I just did a video on gabapentin a couple of days ago, if you want to take a look at that. But Lyrica and gabapentin can help with nerve pain that may be part of the fibromyalgia symptoms. The only narcotic that's really recommended is tramadol, and that's even an iffy thing. I read somewhere that some people actually benefit from naloxone, which is an opiate blocker, which is interesting because that suggests that opiates could actually make this condition worse. So tramadol is a possibility. And then we have drugs like cyclobenzaprine or Flexeril, which are muscle relaxants, and those can also help. But remember, all of these drugs that I'm mentioning have side effects, and some of them are pretty substantial. And when I said over-the-counter medications didn't work, I'm talking primarily about Tylenol and ibuprofen. But you can try capsaicin. Capsaicin is a cream that you can buy over the counter that has red pepper in it. It can help desensitize nerves, so that is a possibility. So the last thing I'm going to talk about for treatment are things like acupuncture. Will acupuncture work for fibromyalgia? Well, it depends on the study. Some studies say it can help, some studies say it can't. There have been studies that show that acupuncture works, but so does sham acupuncture. There's been other studies that show that acupuncture works and sham doesn't. So if you have fibromyalgia, I would say try acupuncture because you have nothing to lose. It just may work for you. And the last thing I'm going to talk about is diet. Can diet help with fibromyalgia? Well, the answer to the question is we don't know for sure. But I'm always going to recommend a whole foods diet no matter what is wrong with you, because I think that it's just going to make you feel better and give you more energy in general. They're still doing studies on anti-inflammatory diets and different diets for fibromyalgia, but I think it might be one of those things where it depends on the patient and what they're already eating. But I'm going to recommend you do all the things that you would normally do if you didn't have fibromyalgia. We've already talked about sleep. Drink lots of water to flush your body of toxins. Eat whole foods. Exercise the best that you can. And be sure you're taking care of your mental health. So this is fibromyalgia in a nutshell. If you've enjoyed this video, please give it a thumbs up. If you know somebody with fibromyalgia, or if you know somebody that would like to watch this video, please pass this along to them. Please subscribe to my channel. I will be doing a lot of videos on happy, healthy living. I'm Pharmacist Michael. Be happy and be healthy.